we know the number of people living with dementia is going to increase over the next few years. And so I'm gonna bring us to long-term care for a moment, because we know presently the average wait time for a long-term care bed in BC is around 7 months. And in some parts of the province, it can be up to 2 years. We also know, referencing my earlier comments, that the number of people with dementia is expected to grow, and this will mean more demand for these long-term care spaces. So, Corinne, I'm going to start with you, and then we'll go to Camille and Adrian. But what would you want to see in terms of meeting the number of long-term care beds that's needed to meet this anticipated demand?
We have to really be clear on what that anticipated demand is going to be. We know today there is already a deficit in the long-term care beds, as you just talked about the time waits for these. I don't think we've done a good job in government in terms of addressing not just where we need to go, but where we are today, and really define what those numbers are going to be. My understanding is, just for example, Fraser Health put out their first RFP, I think, in 10 years for increased long-term care beds 2 days before the election was called. And we need to do better at making sure that we're tracking and we understand how many we need. They're an integral part of supporting those with dementia. And we know that I don't know if it's the majority, but a significant number of people in long-term care, dementia is part of the reason that they're there. So I don't know if that was too vague, but we do need more investment. It's a really, really important piece of what we're trying to do.
I appreciate your comments there, Corinne, and to put everybody's minds at ease, my background is unfortunately not the same par as the CNN debate moderators, but hopefully I think thus far it's been a fairly collegial discussion, so I don't think we'll need to rely on those skills. But Camilla, I'll rephrase the state question for you, because recognizing that you are a member of the Green Party, specifically, what is your party's plan to address the anticipated demand when it comes to long-term care?
Yeah, well, like we were sharing actually just before we started, I would like to highlight for people, I've been out knocking at the doors, thousands of doors. And in my riding, this is a big concern. I am hearing it at the doors. So that tells me that this is an important topic that we need to be having these conversations and taking swift action on. The people are very aware that the population is aging. And they are concerned about where we're going to go from here. They continue to witness reactive responses and not proactive. So at the BC Greens, that's our motto, is we want to be proactive in everything right now that citizens are facing. So let me make one thing really clear, which is that we have no time left for tinkering, nor do we have time to wait for years for improvements in models that currently exist. It's time for us to really make changes right now. And so what we will focus on is nonprofit care homes. We are aiming to increase capacity by 10% each year. We also want to make sure that care homes are actually providing the amount of care that they're paid to deliver. So I find it very concerning that there have been 2 consecutive reports from the Seniors Advocate in 2020 and 2023 that have provided evidence of a growing number of hours that are funded but not delivered in for-profit facilities. So again, for your listeners that may now have seen this report, in 2023, it was actually 500,000 hours of care that didn't result in any direct contact to patients. And yet we, the taxpayers, we have paid for those hours. So this is a big concern. We need to ensure when we're paying for direct care that the people that need it are getting it. And the frustration that I'm hearing at the door is that this has become a bit of a pattern with the BC NDP. It's a lack of accountability and transparency around how they're spending money. And the Seniors Advocate, or pardon me, the last Seniors Advocate herself reported that this was an again thing. Again, they found spending differences that were impacting care for residents. She highlighted that many of the cost increases exceeded inflation, that a lack of clarity on many reports and expenses were inequitable funding for capital assets. And all of this is just absolutely unacceptable. We've seen these reports now for 4 years, and we haven't seen swift enough action. So what I've actually seen is in last year, in 2023, Health Minister Dix did say he was going to be addressing this, that he was going to be developing a new funding model that would ensure greater accountability and ensure taxpayers' dollars that were intended for direct care would actually be spent on that and not for profit. but we've heard very little updates since that point. We know that a private firm has been hired to create a plan to address this, but I'm actually quite eager for Minister Dix to follow me on this question, because I'd love to know from him if he has an update for us today and how much longer he thinks we might be waiting for accountability measures to actually be put in place.
Thank you, Camilla. And for those who are listening, the reports that Camilla is referencing were issued out of the Office of the Seniors Advocate. Minister Dix, over to you. Same question.
The action is being taken and has been taken. Just to put it in context and comparison, in the 10 years before I became Minister of Health, 17.8 million was spent on long-term care capital in BC. It's 1.78 million a year, or 3 beds a year. That was the record of the previous government. Our current budget is $3.2 billion, which is about 180 times that. New long-term care programs in health authority owned and operated facilities all over, including in the West Shore, which Camille will be familiar with, but across Vancouver Island and across the interior. In fact, you see new long-term care beds in Fort St. James in communities with growing seniors populations, in Kitimat, in Smithers, as well as in the large areas of Metro Vancouver and Kelowna and so forth. We're building through RFP, through direct working with nonprofit organizations and health authority owned and operated beds, about 5,100 beds across British Columbia, which is an all-time record. We've never seen investment like this in new long-term care beds. We've never seen investments like this in not-for-profit long-term care beds. And yes, Karen, we are doing RFPs as well as we've done over the last number of years in interior health, where new facilities are opening, have just opened in Vernon, in Kelowna, and in Kamloops, for example. So this, compared to any other jurisdiction in the country, and certainly 180 times more than the previous government, is a significant investment in long-term care that's happening now, that's being built now to respond to things. And it's also the quality of the new long-term care facilities we're seeing in place, as evidenced by the Dementia Village in Comox-Courtenay, but also all of these long-term care builds really will be developed and are being planned in neighborhoods of 12. So they are much better places and much better places to live. We're reducing and moving to eliminate multi-bed rooms in long-term care through this plan as well. So these investments are critical investments. And, you know, we'll have a debate here, and I have a lot of points of agreement with Camille and Karen, but I would say there's a significant difference between ourselves and the Conservative Party, which is not here, on all of these questions. When we talk about care standards, when I became Minister of Health, 90% of long-term care beds didn't meet staffing standards. That was the Seniors Advocate report at the time. Now they all do. We've gone from an average of 3.08 direct care hours per resident per day to 3.58 care hours per resident per day across long-term care. 2/3 of our beds are in not-for-profit or for-profit private facilities. They're public beds in those facilities. And we focused increased investment there because people don't often have the choice as to what facilities they pick, or they don't have as much choice as they should have. Finally, across long-term care, we've increased and legislated the role of family councils, which is important to ensure the community's role in the discussion. And we have changed the first available bed policy, so we do allow a measure of choice, especially obviously in larger centers where there's more long-term care homes, where people have the opportunity to choose the long-term care home they want to go to. I think the quality of care is critically important. That's why we are putting in standards for long-term care. I'll just say this finally. People often talk about the last few years. Well, the last few years in long-term care, I know this from family experience, and everybody who's worked in long-term care knows this. We've dealt with the COVID-19 pandemic. All of the national studies showed BC did the best. We did the best because we funded it most. We did the best because we supported workers, getting rid of Bill 29 and Bill 94 and leveling up wages to ensure that workers weren't earning poverty wages in long-term care. We made those changes, and we are going to continue to make those changes. Ensure that workers in long-term care have the supports and the standards that they deserve. Not the worst in Canada, as they were in 2017, but the best. And all of these are critical ways you improve standards, but you build out long-term care. Finally, we need people. That's why we have the HCAP program That's 8,500 people, the most successful health human resources program we've seen. And we need to expand that out, allowing people who are healthcare assistants to become LPNs with new programs in terms of HCAP. So those are some of the things that we're doing to actually build long-term care beds. And it's a significant, I think, difference between ourselves and the Conservative Party, and I'd suggest others as well.
Thank you for that, Minister Dixon. For those who are on here and wondering, we did indeed invite the Conservative Party to participate today. Unfortunately, nobody was made available for us, but I'm grateful for the 3 people who are joining us here today. So to take your time and articulate your vision for people who are affected by dementia, as I know it's something that touches us all.